So every study has its limitations, doesn't it? There are the plus points, and there will be the limitations that you're expected to sort of tease out when you're reporting. You hope researchers are going to tease those limitations out and declare them. And we had a really interesting question in the group tonight, and it's come up before for us quite a bit, and I often spend a bit of time answering. But what an opportunity to ask the person who's done all the work to answer the question for us.
My head's going to be growing.
And so the question is this, and she said, hi, I mentioned Dr. Ovadia's research in a different ICP group, and one of the members was arguing that the research was not done properly and the results were misinterpreted. She gave me a couple of articles as a reference, and this person went on to say that they don't have a medical background, so it's difficult, and this is true for all women who don't have that background, it's difficult for them to judge.
Absolutely,
and she said, could someone explain to me in more detail if these two articles have valid points? I want to believe the Ovadia research. And funnily enough, she said when she was first pregnant, she was fighting not to be induced. So it would be really helpful to have your response to that.
Absolutely. I mean, I think the first thing to say, I am always happy to talk about my research. I had a patient contact me who gave birth this morning, who, she sent me an email to ask for some questions about the paper. So anybody who from any group, it doesn't have to be ICP support. We work very closely together, Jenny, and I know how well the ICP support uses literature and is on top of the literature and critically appraises the literature. But also you will ask me questions if there's something that's not clear to base your conclusions on. And I am happy for anybody to ask me, and I think the door is open. I don't want to tell people how to practice, and that in the paper we were very careful not to tell people how they should treat their women. We provided people with evidence upon which they can make their conclusions. When we sent it in for the initial, we had 16 pages of peer review. So in terms of the question of has this paper gone through a very thorough critical working, yes, it really has. It's been the statistics behind it have actually been cited in other papers where they've gone through completely different, completely unrelated papers, but they've said, oh, these papers have these statistical problems. Here is an example of a paper that has done it right. So eminent statisticians are happy about that approach. In terms of the interpretation and the comparison with other studies, the studies, I do know which studies they compare it with. They compare with a study which we actually included. They provided us data, so that's comparing it with itself. And that has 122 women with cholestasis. We had 5,500 women with cholestasis. They also then compared with two studies that were large, and I really like these studies. I'm not criticizing these other studies. I think that's important, but they were asking a different question. They were asking about particularly stillbirth risk within populations, but without a bile acid concentration. And because there was no bile acid concentration, I think, I was really excited when those two papers came out. They're two American papers, Puljic and Lowe were the authors, and I think they're great. They're really helpful if you don't have the bile acid concentration. What our paper demonstrated is that you can actually manage people differently dependent on what their peak bile acids are. Now, if you don't have their bile acid levels, if there are countries in the world where you just can't get that, then those are going to be the best data that you've got, and you should follow their advice, or well, their recommendations, and interpret them within your local system. Where you have bile acid data available, I would contest that our paper has far more patients and is far more useful to you than studies of 100 women, which are actually included. So firstly, please do feel free to ask me. They can ask through you, and you can always ask me. I'm also very happy to be criticised. If somebody wants to say you've done something wrong, please criticise me. I'd be devastated, but it's a huge responsibility for me to be publishing something that if it's wrong, if I was falsely reassuring women and there are any babies that are harmed as a result, then that really is a problem for me. So if you can criticise me, please do. I'm very happy to look at what the criticism is. Usually it's, for example, people do misinterpret numbers on graphs. So I know one of the things that's written said there were only 13 women who reached 38 weeks gestation, and that's not true. If you actually look at the graph, it's sort of 13 women reached 40 weeks with bile acids over 100. There were over 1,000 women who did that with lower bile acids. So it's just, you know, it's so easy to misinterpret. I know the data inside out. Please just ask me. And, you know, I don't want any arguments, but I really do value, and I really am grateful for any criticism if it does come my